I would invite folks up to the microphone and try and keep your comments brief and targeted. If anyone wants to make comments on how they believe we should be following up in terms of any sort of next sets of activities to build on this workshop, we'd appreciate that as well. Amy Berman.
Thank you, Amy Berman from the John A. Hartford Foundation. This was an absolutely stellar gathering. The level of discussion was very high. I think that the ground was covered very much in terms of the larger issues, infrastructure, payment, issues around the family, the environment, the fit with social and medical care. But there are just a few things that perhaps might be in the woods, but I want to make sure that they do at least get mentioned in all of this. Judith, I shouldn't be saying anything in front of you that you would be the leading expert in, but if we aren't able to address things like observation days, people will not be able to come into home care and have it paid for.
Can I have another day to
speak? I'll just, put down the marker on a couple of things. So we have to think about this holistically within a system that right now has a lot of incentives to do things that would preclude home health. I also want to mention that if we are to look at the future of home health care, that beginning of home health, people of extraordinarily high acuity have a tremendous, the healthcare system has a tremendous regulatory burden in terms of the things that get accomplished in that first visit. So not necessarily are we focused on accomplishing the things that are of greatest importance in that first visit and keeping people safe and well to the second, third, and fourth visit. And that includes, obviously, what needs to occur for the family to know how to handle different aspects of the care, things that George, I know, and Bruce, you would be chiming in about. And the other piece that I did not hear mentioned, so I'll just put one final marker down, life has changed in the United States, and much of caregiving is not a caregiver in the home. It is distance caregiving. And as we think about what that future is, and you've all done such an exceptional job of covering the terrain, but we have to remember that for many, caregiving is a distance issue, and we are going to have to think about what that then should look like. HIPAA should not be a barrier. It really isn't a barrier. And again, Judith, I should never be saying these things in front of you, being the expert, but it is currently, a barrier to team-based dialogue and interaction as perceived by many systems of care. So all of these things are going to have to be part of, a larger conversation if we are going to address the future of home health. Thank you.
Amy, thanks for that. I'm just going to go.
Hello, Karen Marshall, Cadometry Foundation. We provide education and support programs based on evidence-based caregiver interventions to family caregivers. And it's from, I made some comments earlier about my experience as a family caregiver, but it's from my lens operating this nonprofit that services family caregivers that I make this next comment. Patients and their families often come to the issue of care at home or long-term care for serious illnesses in a moment of crisis, and they have to make a lot of decisions from that point. So that's why our organization exists, to help them during those times. But as we talk about all of the great models that have been presented the past couple of days, I'd like to point out that perhaps we should also think about a bridge that needs to be built between the present and that future. And that's basically helping people develop realistic expectations of what it means to have a long-term illness, what it means to age. A lot of people and their families simply don't. And so they come to these major decisions in a moment of crisis when there was all of this time beforehand where there could be some education and some managing of expectations that could take place. I know that I happen to think about this because of my own experience, and I feel absolutely optimistic based on all of the models that you presented, because I worry about who's going to be around to care for me. But really, we should all be thinking about that, and we shouldn't wait.
Karen, thank you.
Thank you. I'm Mike Johnson, Bad Home Healthcare. I'll try to be brief. First of all, George, my apologies for cutting you off. My enthusiasm got the better of me, so at best distractful, at worst rude. But the American Physical Therapy Association has a geriatric certified specialty. We actually have a specialty section for geriatrics and have had it for over 10 years. Unfortunately, it's probably the smallest number of specialists within the profession, so not enough. Right, yep. So that's work for us to do. It's on my checklist. A comment and then a recommendation for maybe how we move forward. So the comment I feel like I have to say, it having taught in academia part and full-time for a long time, is measuring what we teach patients and clients isn't really what we're interested in, is did they learn anything? And so I know that's what we mean, but we continue to talk about teaching, and I just want to be sure that we're talking about learning and how we measure that, which is much harder than the checklist of I taught it. So just a point. But the other is, so I guess for me, what I would like to see going forward is, to steal a phrase from our earlier keynote, how do we shift left faster? I thought that was such a good term, and the slide was terrific, but the conversation here was wonderful, and so thank you to everybody. And so I'm itching to get going a little bit faster. I don't have the answer, but I'd love to figure out how we shift left faster, and count me in. Thank you.
Thank you so much. Dr. Sung.
Hello, Tony Sung, Duke University Medical Center. Building on Dr. Taylor's comments about our ability to now deliver high-level, high-quality care at home, one of the things we've been doing at Duke is pioneering home-based bone marrow transplantation, taking one of the most advanced technical medical procedures and doing it in the patient's home. And we have successfully treated 7 patients in that home-based setting. And we think not only, is this better for the patients, improved quality of life, decreased access to, decreased exposures to hospital-associated infections, but we think it can actually improve other outcomes. And one of the things you mentioned speaking about the future, on October 20th, the IOM annual meeting is looking at the host microbiome interactions. And one of the things I want to bring up, the possibility of home care. By keeping patients at home, we can preserve their normal microflora, the skin microflora, the gut microflora, and that way improve homeostasis, improve human health and disease.
Thank you, Tony.
That's great.
That's great. Any other questions or comments? You want to?
Yeah, sure. So, part of what we want to do is, I don't know about Bruce, but I sort of want to go back and redo our slides that we presented yesterday morning, because I think we sort of have a new way to think about things. So, one of the things that we've talked about is next steps forward. So you may be hearing from us just to try to decide what the next thing to do is. But we, first of all, would like to thank the sponsors for this, because without the sponsors, we would have never been able to do this. We want to thank the speakers. We want to thank the planning committee. It was a team effort, and there were lots of phone calls and things trying to work things out. But thank you so much to everybody for all your contributions here. So it feels like it's one of those monumental things that happen in your career, maybe just a couple times, right? So this feels like one of those meetings. So thank you.
Thank you for convening us. I appreciate it. I'm sure we all do very much. I just want to say we should unite. We have nothing to lose but our silos.
So I know that for those who are left here, I just wanted to we've been constantly asked about the slides and the webcast, and I want to assure you they will get up on our website. It does often take us a little bit of time. If it was something I could do myself, it would happen sooner, but we have processes to go through, including getting permissions from all our speakers. But it's great that there's so much interest. People always ask us what's next. For us, there will be a report that will be produced. We call it a workshop summary, and it will not have any conclusions or recommendations. It's really a reflection of what was discussed for the last 2 days. We do have still a rather lengthy process for that. We can usually get what we call a pre-publication out, hopefully in about 3 or 4 months. But if you ever have questions, you can contact me. And I just want to thank the planning committee again, especially our co-chairs who were on the phone with me, I think, every week for the last couple months. And we're always on the conference call before I was. So thank you all, and thank you all for coming.